Welcome to the third part of this lecture, which is on the role of the health system to provide universal health coverage and thereby contribute to the improvement in population health. What is a health system? It has been described as the organization of resources, actors, and institutions related to the financing, regulation, and provision of health actions. What then are health actions? These are activities whose primary intent is to improve or maintain health, such as a mastectomy for breast cancer. A health system consists of multiple components which are related mainly to its functions. The functions I will briefly mention are: number 1, stewardship; 2, financing of healthcare; 3, provision of healthcare; and lastly, resource generation. As will be clear later, each of these components are integral to a health system which aim to provide universal health coverage in any country. The first component is that of stewardship. This concerns the overall planning, monitoring, and evaluation of the entire health system. This stewardship role is usually played by the government and includes elements of legislation, enforcement, formulation of guidelines, rules, and regulations. This is an extremely important function, as this should provide assurance of integration of care, assurance of quality and safety from various healthcare providers, as well as the assurance that healthcare facilities are distributed and financed such that healthcare can be accessed by all. The second component is that of financing of healthcare. This concerns the gathering of sufficient funds, pooling of funds to spread financial risks, planning and purchasing of the required mix of different healthcare services according to population health needs. The financing of healthcare of any country can impact on the progress towards and achievement of universal health coverage. For example, inadequate funds for health can have consequences on the availability and distribution of healthcare in a country. This in turn can have consequences on the amount of healthcare services used by their population and their health status. Another important aspect here is the balance between private and public financing sources. In general, too much reliance on private sources, such as private health insurance, may prevent the poor from accessing needed healthcare. Thus, many countries, including Malaysia, rely on public sources of funds to finance care. The dominant provider of healthcare in Malaysia, the Ministry of Health, is mainly tax-financed. The third component is provision of healthcare. This concerns decisions on levels and quantities of different levels of services. Example, preventive, promotive, curative care, the healthcare providers permitted to provide the care, and the organization of these providers. Example, the mix of public and private health sectors. Many countries have a dual public and private provider system. Depending on how these systems are financed and the providers distributed, public-private provision of care can contribute to universal health coverage. The fourth component is resource generation. Health systems are not limited to institutions that finance or provide services, but include organizations that produce inputs to those services, particularly human resources, physical resources, such as facilities and equipment, and knowledge. The quantities and types of health resources may vary from country to country. Many low and middle income countries have relied on paramedical staff, such as nurses, to provide care, which may be provided by doctors in high income countries. To sum up, the way health systems are structured can have impact on the achievement of universal health coverage. This involves the rational use of limited resources to extend coverage to the entire population to be covered, to extend scope of services covered for the entire population, and to reduce costs to patients. This concludes the third and last part of this lecture, which is on the contribution of health systems towards achievement of universal health coverage, which in turn can lead to improvement of health. Here are some additional reading material which will provide more detailed discussions on the issues I have mentioned. Before I end, I would like to summarize the main points in this lecture. The first is that health is of value to society. Therefore, society should put in measures not just to improve population health, but to ensure that health is distributed fairly in society. The second is that many factors contribute to improvement in health, including appropriate use of healthcare. Society should focus on those factors that can be modified and for which society has a collective responsibility over. One of these social determinants of health is the provision of healthcare for all who need care or universal health coverage. The last is that provision of universal health coverage requires a well-run and functioning health system designed to align with the principle that healthcare be provided to all who need care without undue financial hardship. This then should be the role of any country's health system to ensure universal health coverage for its population.